Okay, hiya. This is just a little introduction to the following video. When we were faced with the challenge of delivering home intravenous therapy via a PICC line, we discovered that there wasn't much in the way of information available about it prior to us agreeing to do the training and assessment. So we thought maybe we would do our little home video and put it out there. I hope it's going to be of some help to you. Right, morning Rob.
Morning Fiona.
How are you doing?
I'm fine.
How do you feel? Any temperature, chills, anything like that?
No, I'm feeling fine. Yeah, fine.
Okay,
fine.
grand. Do you want to just bring that dressing down? Pull it for me. Okay.
You've got that. I've got a new dressing put on yesterday.
Oh right,
So
okay,
it's
that's grand.
transparent. So there you go.
Right, let me just check the entry site then. So it looks to me that there's no swelling or inflammation there. There's no redness. There's no tracking up your arm at all. It's all looking good. So I think that's good to go ahead.
Feels quite normal.
Yeah, grand. Okay, so I'm just going to wash my tray and surface and then gather my equipment. I'm going to wash this on the inside and the out. And then I'm going to just wash the table that I'm going to use. Things ready. Okay, let me just check the date and that it's what we want. So it's ceftriaxone, used before the 7th of the 12th, 2023. That's good. And just check the integrity of the packaging. All looks good. That out the rigger. Sometimes a bit tricky to open. Pop that in my tray. And my gloves. So everything's prepped. All I need to do now is wash my hands again. Yeah, I'm washing my hands with soap and water, but you can use alcohol gel as well. I'm turning the tap off with me old, what do we call that? Paper towel. Making sure my hands are really dry. Morning. Now the washing of my hands was to protect our Rob, and the donning of these gloves is to protect me from any of the harmful chemicals that I'm dealing with. I'm just going to show you that the balloon in here at this stage is full, and then when we start infusing it, it will slowly empty and empty faster towards the end, and when it's completed you'll see that the balloon becomes flat. Okay, right, so I've undone the clamp. I'm going to undo the cap. Now what I'm looking for is a bubble forming, bubble of fluid forming at the end of the extension set. There we go. Right, that's ready to go. Then I'm just going to check these are saline syringes, and I'm just going to check that it's in date, and that's the 5th of 2026, so we've got loads of time. I'm just going to knock a little bit of air back, and then I'm going to loosen the cap, withdraw, just because it makes it easier to handle the syringe, and then I'm pushing the air through. And you can see the bubble at the top there. And that's ready to go. Right, now one of the most important things we're going to do is make sure that that hub is nice and clean. And we do that by scrubbing it with this alcohol wipe. Right, Rob.
Okay.
I'm going to scrub it 3 times with different parts of the wipe. And then, once that's done, we're going to let it dry. Okay. And then, without touching the ends of anything, I'm going to put the tip in there, push, and give it a twist. And then what I'm going to do is just give a couple of pushes there to put a couple of mils in, and the next thing I'm going to do is withdraw, and what we should see is a little flash of blood coming along that clear bit there. And there we go. So we know the line's functioning, and then I'm just going to use a push-pause technique to get all that saline in, flush the line fully. That's that done. And then I'm going to twist in the opposite direction, and that'll come off. I'm going to hold that so it doesn't get contaminated, and then I'm going to take the cap off there, and again without touching, push and twist, and we're done. Okay, so you can see the balloon is fairly full. What we're going to be looking out for is that deflating and then becoming flat. What time are we on?
9:56.
Oh, we're a little bit late today. Okay, grand. So I'll see you in about, what, half an hour or something like that?
Yeah. Give you
Okay.
a call.
And that's it for the moment. Alright, Rob, half an hour has passed. Let's have a look at the balloon. You can see it's gone down a little bit. It always goes down slow, and then towards the end it seems
does.
to just disappear very quickly.
It's about 2/3 through.
So we'll give it another 10 minutes probably.
Yeah, I'll give you a call in 10 minutes or a tap.
All right.
All right. Thanks.
Okay, Rob, we must be about, what, 3/4 of an hour now? Or something.
Yeah.
Okay, let's have a look then. We're about 40 minutes in, are we? Something like that? 45?
45.
Yeah. And that balloon looks to be pretty deflated to me. It's fairly flat along there. So
I agree.
I think we're ready to disconnect.
I'm glad that you were disconnecting and not some other word.
Unattach you. Washing hands again. Using disposable paper towel, so you're not using a towel that's hanging around damp. Remember not to touch the tap when you turn it off. And get your hands fully dry. Otherwise you won't be able to get your gloves on. A week today.
It's going to be a big week next week.
It will be the last one.
So, yeah. It'll be 3 weeks at home and probably 2 weeks in hospital of some sort of description.
Yeah.
So that's
Just a good demonstration of how hard it is to get your gloves on sometimes, even with dry hands. Right, okay, so say flush ready. I'm double checking the date. That's the 4th, 2026. I'm going to unscrew the cap like we did before, pull back just to get it going, and then squeeze out the air as the bubbles come to the top. And then we're going to get another wipe. I always do that. I get the wipe at the ready, don't I? And then decide I've got wet hands. Never mind.
you manage very well.
Okay, so I'm going to disconnect and then give the hub a scrub 3 times like we did before. And wait for it to dry. And then again, without touching any of these end bits, and to put the cap of the syringe in there, tip of the syringe, and then twist to the right, and then quick push pause. This is to flush all the antibiotic through. And then when you get near the end, you're going to be pushing that last mill in at the same time as I'm twisting anti-clockwise to disconnect. Comme ça.
Fantastic.
And then you're all done. Let's pop this back up.
Now I'll keep hold of this. Okay. Brilliant.
All done.
Fantastic.
Now I'm just going to put this in the clinical waste.
And then what happens to the sharps box then when we're
Oh,
finished with it in a week's time.
Fingers crossed the district nurses will take it. That's what they've said. The rest can just go in our domestic waste. Done for another day.